My name is Zach Underwood. I'm a care transition coordinator. SNF at home differs from traditional skilled nurse facilities in that we allow our patients to go home to do the healing part after their hospitalization. It's a much more individualized care. It allows our team to be more in tune with the patient's needs, along with their family and their primary care physician. It allows them to heal in the place that they're comfortable, and a lot of times that helps the outcomes way more than being in a traditional skilled nurse facility. The SNF at Home program is able to fill that gap in that they do qualify for home health, but they do require a little bit more therapy and intensive visits. We coordinate the SNF at Home program with the case managers at the hospital. We are in direct communication with our liaisons. We look through the patient's chart and determine if they are going to meet eligibility requirements to qualify for our SNF at Home program. We look at each individual patient's chart and what's going on with them, seeing if they actually are going to benefit from the program. And if they do, we work directly with the hospital to figure out the best and quickest and most efficient way to get that patient home. The primary care providers that we will communicate directly with once the patient is at home to make sure that the patient has everything that they need to get the best outcomes possible. We take in each individual person's needs. That means everything. Without the ability to look at a person as an individual and work to what they need, why are we doing any of this? We're doing it for the right reasons. The typical diagnosis for SNF at home are your orthopedic patients. We also see a lot of patients that are post CVA or a stroke patient. We also see a lot of patients that just have general debility, that maybe are suffering from diabetic problems or maybe congestive heart failure issues that have made them a little weaker than they normally are. And the SNF at Home program is able to step into that role and kind of fill a gap so that they can actually go home and enjoy the benefits of some more intensive therapy than they would normally get from a standard home health episode. The assessment is extremely important and to make sure everything goes smoothly. Technology plays a huge role in the management of our SNF at Home patients and our traditional home health patients. We have a system that allows us to monitor our referrals from the time that we get the referral from the hospital until the time the patient discharges. The way this helps SNF at Home patients is we're able to constantly on a daily basis monitor what is going on with that patient so that we can update our operations team on things that they need to know about to prepare for the patient when they come home. We're able to make adjustments to those ancillary services as the needs of the patient change. With the technology and the ability to communicate directly with our partners, we're able to adjust those needs on the fly in real time as we need it. The patient never has to worry about missing a meal, missing a ride, missing anything or needing anything that's going to make their stay on our service enjoyable and the best that it can be. I think Compassus has created something that is going to be around for a really long time and that is really going to revolutionize home care for our patients.